So we ended on the assessment of the gums previously. I did miss the teeth, so we'll go ahead and start from there and then work our way to the oral cavity and the oropharynx. So we were palpating the gums. We stated we have to take a good look at the gums, make sure you have gloves on, and check for anything abnormal. So now the teeth. So when you assess the teeth, you want to make sure he opens his mouth, and you want to make sure that you look at the teeth. And you want to, what you're looking for is any wear, any notches, any cavities, caries, or any loose or missing teeth anywhere, and make note of that. Now, let's go ahead and move into the oral cavity. There are 7 ways to assess the oral cavity. Now, let's start with the dorsum of the tongue. Now, with the dorsum of the tongue, go ahead and open your mouth. Now, you need to check for, no, bring it down. So you need to check, just keep it resting. So what you're checking for is you want to make sure that there's coating, that there's no coating on there, that there's no ulcerations or variation in size or color. You also want to make sure that it is a dull red, that it's moist and it's glistening. There should be no coating, like I said, or lesions on it. And then we're going to ask him to go ahead and stick his tongue out. So when he's sticking his tongue out, we are actually testing cranial nerve 7. We want to make sure that it is midline when it comes out, that we want to make sure there's no tremors, that there's no deviation, like I said, and there's not a limited amount of movement with sticking out his tongue. Now, we're going to go ahead and ask him to touch the tongue to the top of his palate so that we can take a look at the ventral portion of his tongue and inspect the floor of the mouth. So go ahead and put your tongue up like this, and I need you to open your mouth. Okay, so perfect. Now, if you see here, you can very, very clearly see the veins coming out of the ventral side. They're very, very large veins, and you can see them very well here. You're looking to make sure that everywhere here is a pink and smooth surface as opposed to the dorsum. You also, on the bottom here, you see that he does have a frenulum. Now it's that little portion of skin there that's keeping that tongue connected to the bottom of the mouth here. And then I can definitely see here the different ducts that are on each side of the frenulum. And those are also salivary glands. They're called Wharton ducts. So those are things to look for when checking the bottom of the mouth, the floor of the mouth. Now, we're going to go ahead and inspect the lateral borders of the tongue. So by doing this, we'll go ahead and ask him to open his mouth, and using a light, we can go ahead and ask him to stick his tongue out once again. Stick his tongue out. And you're wanting to examine the sides of the tongue for any white or red marks anywhere. But it looks like it looks good. Now, when you palpate the tongue again, you will need to use gloves. We'll ask him to stick his tongue out once again, and kind of stick out your tongue. And then with gloves, we would palpate the tongue for any lumps, nodules, and then we would also put our fingers at the bottom of the mouth and palpate underneath there as well for anything like indurations or ulcerations as well. Now, after we're done with that, now we'll go ahead and check the palate and the uvula. Go ahead and open your mouth once again. So, touch your head back. Now, we do need a tongue depressor here because patients tend to bring their tongue up when you do this. So what you're doing is you're checking that uvula. You're checking that midline protrusion from the palate going down and anterior to the pharynx. And that one should be midline, okay? And you should be able to see that on the top portion. The hard palate is the area where it's somewhat white dome shape with transverse rugae running along it. And then the soft palate is a continuation of the hard palate, but it is a lot pinker than it. So we've checked all of those now, and we've seen that they are in the correct place. Now, we want to check the soft palate movement. So when we do this, we're going to go ahead and ask the patient to open his mouth once again. Like we did before, we're going to go and depress that so we can take a good look at that uvula. We're going to ask him to say, ah.
Ah.
Perfect. So we see that the soft palate rises when he says ah, and the uvula actually remains midline, which are all normal findings. Now, these are also testing cranial nerves 9 and 10. So, all of that is intact. So now, last, we're going to go ahead and assess the oropharynx. And in order to assess the oropharynx, there are 3 different ways to do that. Now, the oropharynx, we're going to go ahead and assess the oropharynx and the tonsillar pillars. Now, the tonsillar pillars are the 2 areas that hold the tonsils in place. The tonsils, so right in the middle of the 2 tonsillar pillars at the back of the throat. And basically, when assessing the oropharynx and the tonsillar pillars, we want to make sure that they are all a matching pink color, just like the pharynx. So we'll go ahead and do that. Tongue depress, and then using our light, we want to do that, depending on if you're right-handed or left-handed. So I'm assessing the pillars. I'm assessing the pillars, and yes, they are pink, just like the pharynx. Now, the posterior of the wall of the pharynx should be smooth, glistening, and pink, which it was. And we need to touch the posterior wall of the pharynx on each side to elicit a gag reflex, which we just did, and we don't need to repeat that again. So those are also assessing cranial nerves 9 and 10. That completes the assessment of the ears, nose, and throat. Tune in for the next video.